Welcome to Module 7, Motivational Interviewing. I'm Dr. Nicholas Pennings. This is the Nicotine Cessation Training Program. In this module, we'll be introducing motivational interviewing, which is a useful tool in helping people move towards change. Motivational interviewing is an effective way to talk to your patients about change. The spirit of MI involves partnership, acceptance, compassion, and evocation. The partnership is working together in a collaborative effort on a strategy for change. This is different from the usual provider-patient role, where the provider provides an expert role and the patient comes to you for expert advice and you tell them what to do. This is more of a spirit of collaboration, working together, developing a plan together, and not just do what I say. It involves acceptance and recognizing that every person has the right to make their own decisions, even if it's a bad one. And this is really difficult, that we often see people making bad decisions, unhealthy decisions. And we need to accept that they have the right to do that. You may not agree with it. Acceptance doesn't mean agreement. It just means that sometimes they will make unhealthy choices. So the key here is not to be tied to the outcome, because that tends to create frustration and then an unwillingness to continue to participate. Compassion is a key component of motivational interviewing, providing support that keeps the patient's best interests in mind. It's about what's right for them. And evocation. The best ideas come from the patient, and this is hard. We often want to provide the ideas for change, but when they come up with the solutions, when they come up with the strategies themselves, they're much more likely to adhere to them and comply with them. One of the components of motivational interviewing is recognizing and dealing with ambivalence. Ambivalence is a natural part of any change process, and it emanates from the pros and cons. Anybody who's thinking about making a change has reasons why they might want to change and reasons why they might not. So when it comes to quitting tobacco, they have reasons why they like using tobacco and reasons why they want to get rid of it. So a common statement might be, I know smoking is bad for my health, but I don't think I can cope without them. And this creates an internal conflict about change. I do, I don't, I do, I don't, and it leads to indecision. It tends to be paralyzing and tends to even create anxiety about the decision because they're not sure which direction to go. And ambivalence is something that persists all throughout the quitting process, that just because they make a decision to quit doesn't mean that there still are not pros that make them want to continue using tobacco. So that can be a very important and driving force behind relapse. So some of the basic skills associated with motivational interview include the acronym OARS. The O and OAR stand for open-ended questions. And so when we're talking to people about change, we want to avoid yes and no type questions. By asking open-ended questions, allows the patient to elaborate and express what's really important to them. So what are your reasons for wanting to quit tobacco? This will then elicit a number of reasons as opposed to just saying, do you want to quit tobacco? You want to avoid changing the question from open to closed. So an example of doing that might be, what are your reasons for wanting to quit tobacco? You know smoking is bad for you. That's going to close the question and take away the open discussion. The A stands for affirmations, and these are positive statements that you want to make towards the patient that recognizes the attempts that they've made in the past, what they've been able to achieve and accomplish in the past with quitting tobacco. This helps to build self-confidence as well as self-efficacy, a belief that they're able to do it. The R stands for reflections. That's understanding what the patient is thinking and feeling and reflecting back on the patient, to the patient. So when a patient is saying that, I think I want to quit smoking, I know it's bad for me, a reflection would be, tell me more about why you're thinking and why you want to quit smoking, or tell me more about how you think smoking is bad for you. What this does is it conveys empathy and understanding, and it also helps the patient to elaborate on what they're thinking. Summaries are longer reflections on more than one patient statement. Selective summaries help guide the patients towards change and also helps to build a discrepancy. When a patient has been giving you a number of reasons for and against, a summary allows you to discuss what it is that makes them want to quit. So they're telling you that, or you can go back to the patient and say, well, you tell me that you're interested in quitting smoking, but you're not sure that you're going to be able to, that you've tried in the past, but you've had failures. You recognize that it's very important for your health, though, and you really want to try to quit this time. So working at identifying what their discrepancies are and helping them move towards quitting. As we mentioned in the previous module, elements of change in motivational interviewing include importance, competence, and commitment. Measuring change on the readiness scale, measuring from 1 to 10, on a scale of 1 to 10, with 10 being the greatest, how important is it for you to quit smoking? How confident are you in your ability to quit smoking? How committed are you to quitting smoking? And as we mentioned before, when they give a number, you want to discuss why it's not a lower number rather than a higher number, because that helps to elicit change talk. The purpose of eliciting change talk is to move people through the 4 processes of motivational interviewing, and that includes engaging, focusing, evoking, and planning. Engaging is a process of establishing the relationship, and this is aligning yourself with that patient. So what helps people feel engaged? Well, making them feel welcomed, at ease, making them feel comfortable, making a connection, a handshake, eye contact, using their name, and expressing empathy, especially when they're talking about particular challenges that they're facing. You want to avoid disengaging. The things that cause disengaging, including assessing, when you're asking a whole series of yes-no questions, that tends to disconnect the patient. Telling the patient how to fix the problem. You want for them to come up with the solutions, that's going to be more likely to be utilized by the individual. Exerting a power differential can be disengaging, where you exert your role as an authority figure. Do this because I am the doctor, or I am the pharmacist, or I'm the one who's telling you that you need to do this. And labels also disengage. So calling people names such as smoker or addicted will tend to disengage the patient. Part of the questioning process includes asking open-ended questions. And while it's important for a patient to elaborate on why they want to change, you also need to guide it and focus it. So focusing is an ongoing process of making sure that the discussion is moving in a productive direction. This includes setting an agenda, what the specific goals or objectives are in the interview process and what you want to accomplish. Evoking is the next process, and this is a very important process for eliciting the client's own motivation for change. And this is where we can try to bring out their reasons, because their reasons for quitting tobacco are more important to them than yours are. We do this through change talk versus sustained talk. Change talk is where a client discusses what items that favor the movement in the direction of change. Why do they want to make a change? And what we want to avoid is utilizing the writing reflex. So patients will make ambivalent statements towards change. As stated here, I know smoking is bad for my health, but I don't think I can cope without them. So change talk would focus on the beginning part of that statement, and writing reflex would focus on the latter part. So if you focus on the I don't think I can cope without them, writing reflex is a tendency to go get into a discussion of why you think that person could cope without their cigarettes. So, lots of people cope without cigarettes. You don't have to smoke to cope. And while you're making those kind of comments, the person is thinking about, why they need their cigarettes to cope with change, to cope with any challenges that they face. If you focus on the beginning part, I know smoking is bad for my health, with comments like, tell me more about what you know and how smoking is bad for your health, that's going to then elicit change talk, where they're going to be talking about more about the reasons for why they want to change. So focus on those comments that are made that improve that person's willingness to change versus enhancing their desire to continue. Planning is the fourth process, and that really involves developing a specific plan. So just discussing why it's important to quit smoking is meaningless unless you have a specific plan, a specific quit date, a specific strategy that you and the client are willing to implement, and it has to be in part their decision. Developing a SMART plan. SMART is an acronym for specific, measurable, achievable, relevant, and time. So specific goals, if it's maybe quitting smoking, but sometimes it's just reducing the number of cigarettes or changing some of the routines and times that people smoke. Quitting is not always the goal because they're not always ready to completely quit. Goals should be measurable. You want to quantify and track the change. You want them to be realistic so that they can be achieved. You want them to be relevant, important to the patient, that is their reasons for wanting to set the goal. And you want them to be timed. You want to follow a specific timeline for change, such as setting a quit date or getting down to a certain number of cigarettes or eliminating certain times of smoking. So set a timeline for achieving that. So in summary, motivational interviewing helps elicit the patient's own motivation for quitting. The spirit of MI is a collaborative effort to working together with the patient to achieve their goals, and the process of MI involves guiding the patient through a change process towards a quit plan.